The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Last week, I told you that the budget reconciliation bill had barely passed the House, and it was under major debate in the Senate, with both moderates and conservatives wanting to change the bill, which would cause major issues when it went back to the House. We're going to stay on the same theme here today, talking about the impact on the uninsured rate from the budget bill that passed the House. Again, we are recording this about 10 days before it airs, so there could be some developments not in this podcast. But I think the vast majority of what I say will still be absolutely correct. We will take our normal 3 breaks today as well to break it up. So let's get right to it. The theme of this podcast today is the Republicans are in stealth mode on healthcare coverage cuts, but the impacts are real. A number of readers and listeners have been contacting me to have me help sort out the great number of Americans that will be uninsured if the House-passed budget reconciliation bill also passes the Senate. After all, they note, didn't Donald Trump, House Speaker Mike Johnson, and other GOP officials promise no coverage cuts in health care, at least in Medicaid? It is a great point, and here is my take on it. I will tell you all about the projected number of people to lose their coverage and how the Republicans say they're approaching the issue. But first, we need a little history. Back in 2017, under Trump 45, the president and a GOP Congress explicitly set out to repeal insurance coverage by substantially gutting the Affordable Care Act, which expanded Medicaid to additional higher-income populations and established the state exchanges with premium subsidies and cost-sharing subsidies depending on income. A substantial bill passed the House that would have repealed the ACA, but a skinny one failed in the Senate when Senator John McCain, a Republican of Arizona, returned from his terminal brain cancer diagnosis to give the bill a thumbs down. Nonetheless, the explicit attempt to repeal the Coverage Act led the GOP to lose the House in the 2018 midterms. As of 2017, the GOP had a substantial majority in the House. But after the 2018 elections, that majority literally swung the other way to Democrats. The Senate stayed in GOP hands after the 2018 election. Now, generally, the party in the White House tends to see poor results in midterm elections, but the ACA repeal clearly impacted the results of the House races and the number of seats lost to the Democrats, so they could take back the House chamber. The GOP is still spooked by the losses back in 2017. In general, party leaders, including Donald Trump, signaled that more overt attacks on healthcare coverage would undermine the GOP's ability to maintain control of the House. And their concern is certainly merited, especially given the very tight numbers in the House today and the fact that most Americans today like Medicaid and even the Affordable Care Act. Consider a recent healthcare policy group KFF poll that finds that at least 4 in 10 Republicans are worried about the consequences of Medicaid cuts. Further, of the Republican respondents, the poll found that 75% are worried that sweeping changes to the program would hurt their family's ability to get and pay for care. About 70% are concerned that the cuts would lead to an increase in the uninsured and negatively impact providers. The support and number worried increased if those surveyed are independents or Democrats. That means, at least in swing districts, these coverage issues certainly resonate in elections. That is why Trump and some GOP leaders swore off overt reductions to health care coverage. At the same time, they adopted what I would call a covert or stealth approach to paring back insurance programs, including Medicaid and the exchanges. But as the Congressional Budget Office showed their final bill score of the House-passed budget reconciliation bill, even the stealth approach to cuts in Medicaid and the exchanges has wide and far-reaching impacts to coverage. With that brief explanation of 2017 and this year's different approach to healthcare spending cuts, we'll take our first break. And when we get back, we'll discuss the major reductions in the budget reconciliation bill and the impact on the uninsured. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage and a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking again this week about the budget reconciliation bill, and our particular focus is the spending reductions impacting healthcare and what that means for the number of uninsured in the country if the bill passes. So the major reductions and the impact on the uninsured. After a manager's amendment in the House that added to healthcare reductions, the CBO finds that healthcare cuts amount to about $1 trillion over the 10-year budget horizon. The big Medicaid policy changes include work requirements, limitations on state provider taxes to generate the state matching contribution, and various enrollment changes and restrictions. Medicaid total savings are about $864 billion over 10 years. The CBO says about 7.8 million will lose Medicaid due to the bill's Medicaid provisions. The bill also has reductions impacting the Affordable Care Act, including changes to premium tax credits for migrants, increased recoupment of premium subsidies paid out at levels that are too high from income, and increased eligibility checks. These ACA changes save about $230 billion over 10 years. About 3.1 million would lose coverage due to the bill's ACA provisions and some other provisions. The CBO also said that about 4.2 million will exit the exchanges and remain uninsured due to the expiration of the enhanced premium subsidies at the end of 2025. Now, the bill does not technically repeal the enhancements. They sunset under existing law, and the Republicans have not included funding to continue the enhancements. An additional approximate 900,000 would also lose exchange coverage as a result of a proposed Trump administration rule issued in March that would shorten the annual enrollment period, require stricter eligibility reviews, and make other changes. This brings the total increase in the number of uninsured to 16 million by 2034. So how are states impacted in terms of the uninsured rate? With the CBO's new score for the bill, the Healthcare Policy Group KFF has updated its analysis of the impact of the increase in the uninsured rate by states and the number of the uninsured. Much is dependent on what states actually do related to the healthcare policies. But KFF finds that the reconciliation bill would result in increases in the uninsured rates of 3 percentage points or more in 16 states and the District of Columbia. California and Florida are the top 2 states in terms of newly uninsured, 1.7 million and 990,000 respectively. New York, Texas, and Illinois follow at 920,000, 770,000, and 500,000 respectively. But if you take all of the coverage impacts noted earlier, KFF finds that the greatest uninsured increases in Florida, Georgia, Louisiana, Texas, Mississippi, Washington, and the District of Columbia, where the uninsured rate is expected to increase by at least 5 percentage points. The national increase in the uninsured rate would also be about 5 percentage points. 35 states and the District of Columbia would see an increase in their uninsured rates of 3 percentage points or more. About half of the 16 million more people uninsured would be in Florida, 2.3 million, or a 9% increase in the uninsured rate. Texas, 1.9 million, or a 6% increase in the uninsured rate. California, 1.8 million, or a 4% increase in the uninsured rate. New York, 920,000, or a 4% increase in the uninsured rate. In Georgia, 750,000, or a 6% increase in the uninsured rate. With that explanation of the impact nationally and in the states on the uninsured rate if the House bill passes, we'll take break number 2. And when we get back, we will jump into the rationale the GOP is bringing to many of these cuts and what some of the problems from my standpoint are. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and I hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the budget reconciliation bill that passed the House and is now being debated in the Senate, and what the healthcare reductions will mean for the number of uninsured in America. So we told you when we got back, we'll talk a little bit about how the GOP is rationalizing some of these cuts and how I see some problems here. So the first question we might ask is, aren't work requirements fair? Many would argue work requirements are fair, but if you dig deep into the issue, you will learn the following. Many studies put the number of people in Medicaid who would continue to qualify due to work or exemptions could be more than 90%. The program to track and document work requirements would also be very expensive. The number of people who are slated to lose coverage due to work requirements is not so much related to their lack of work or exemptions, but due to administrative snafus by the states that will administer the requirement, a convoluted and broken Medicaid enrollment and eligibility process that will become worse, and health literacy and language barriers of enrollees. State experiments in Arkansas and Georgia also show that work requirements are expensive and lock people out of coverage for no reason. Upfront coverage, too, saves compared with crisis emergency room and inpatient coverage. In the end, we will all pay for the crisis intervention and pay more. Thus, healthcare coverage should not be linked to work, in my view. In short, people will lose coverage because of a lack of awareness and confusion over the overall process, and it will cost society more down the road. House Speaker Mike Johnson argues people will not lose coverage if they follow the rules. But it is not that simple, as I have pointed out. As any of us know, when we battle each year during healthcare open enrollment and helping our parents sign up for Medicare when the time comes. Johnson's elitist statement rivals that of Marie Antoinette losing touch with the plight of the people during the French Revolution. The next real question we have here, pointing to the fallacy of some of the Republican arguments when they justify the changes in the House budget bill, are tighter eligibility and proving eligibility more often fair? I would argue that states and the federal government investing in systems to prevent fraud and improper enrollment is not unreasonable. I actually am supportive of some of the proposals for tightening eligibility and enrollment. But at the same time, many of the proposals in the reconciliation bill put unreasonable barriers to enrollment in place. The cost of more frequent qualification is huge, and states struggle now to timely and accurately process enrollments. We saw this during the return of redeterminations post-pandemic. We saw most people were disenrolled for administrative reasons. It is hard to ask people who need coverage to jump through hoops to get or maintain coverage when states themselves are wholly unable to administer a clean and fair enrollment process. Add to this the philosophical disposition in some states to do anything to limit Medicaid enrollment and growth, and the inequity is even worse. Let's tackle our last issue here about what the GOP is saying. The GOP is saying they are not taking away the premium enhancements. That is true. The Democratic passed law is expiring. If Democrats wanted to, they could have made the enhancements permanent when they had the chance, when they were in control and passing bills. But the GOP most assuredly will still get blamed for the expiration during election campaigns in 2026. After all, over 4 million will lose coverage if the premium enhancements expire. On the policy front, I am worried about some of the likely fraud in the exchange program. The Paragon Institute has done a good job documenting some of this. So some reform in exchange enrollment and perhaps the size of subsidies, enhanced or not, is something to look at. But I also take a long view of things on these enhanced subsidies. Whether I personally like the size of the subsidy enhancements or not, they have driven coverage, and ultimately that is good for the system in my view. Letting them expire is not the right move. Perhaps an extension with some tweaks might be reasonable as we debate the virtues and harm over time of enhancing subsidies. With that, we will take our last break and we'll come back for a brief conclusion. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We are talking about the budget reconciliation bill and the impact on the uninsured. So we promised a brief conclusion here. Well, in the end, whether the GOP is operating in overt or stealth mode, major impacts on coverage are the reality, and that does have major election impacts for the midterms in 2026. The reconciliation bill does not repeal the ACA, but it and related changes, including the expiration of the enhanced subsidies, lead to 16 million fewer insured. By my count, the ACA Medicaid expansion exchanges have provided coverage over time to ensure that 45 million people were not uninsured. Thus, more than a third of that coverage would evaporate if the bill is passed. None of this says that spending reduction should be pared back, though, overall. I happen to believe the following. A $37 trillion national debt is outlandish. A bill that increases deficits to over $2 trillion annually is fiscally irresponsible. A budget deficit of over 6% of GDP is twice any reasonable level economists say is reasonable in good economic times. And borrowing $1 trillion annually to service debt has so many ugly repercussions over time for funding needed services. The Trump administration is on a public relations campaign now attacking the CBO's analysis and methodology about what will happen to deficits and debt if the reconciliation bill is passed. I will admit that it has a point to some degree. The CBO score is very much a static analysis, and the Trump folks argue there are dynamic economic and revenue growth effects related to passage of the bill. But we do have to remember that most of the tax cuts are already online and any dynamic effect has largely been seen. And it is hard to argue that any remaining dynamic effects of the bill will do anything to substantially cancel out the huge ongoing deficits and rising debt. There are other ways to reduce spending and tackle our debt and deficit problems than to fundamentally pare back healthcare coverage. Some see a huge disparity between states in terms of Medicaid funding, with blue states garnering far more than red states due to overly generous programs. A case could be made that benefit structures in Medicaid and the exchanges could be standardized with some diminution and price reform to lower the cost of care. There could also be real attempts to rein in fraud, waste, and abuse as opposed to what the GOP proposes. This would then help ensure everyone could maintain coverage. The problem is Washington is entirely dysfunctional. There is no consensus to do right by people or the country's finances in either the Democratic or Republican parties. If Mercutio were around today, he might say, "A plague on both your houses." With that, we'll conclude this edition of the Healthcare Labyrinth podcast, and we'll be back next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.